Hello, I'm Dr. Dennis McKenna. Welcome to another edition of Inside Albany Med. And I'm pleased today to be joined by our Employee of the Year, Colleen Umholtz. Great to have you here.
Great to be here. Thank you.
So officially the 2024 Employee of the Year, but your reign will actually be in 2025. And we announced that most recently at the Center Combined Leadership meeting. It was wonderful.
It was wonderful. I was completely shocked.
Yeah, that was for me the best part. So actually, a little backstory. They don't tell me who the Employee of the Year is until the day before. And so when I learned, of course, I was very excited. And we'll talk about how we know each other at work and outside of work. But I thought that was great. And then, of course, I got to learn that your family would be there. And they were all there, including your husband, Joe, and your 3 daughters, your son-in-law, and even your grandson was there.
All of them.
All of them was there. Yeah. Your grandson, though, he stole the show.
He ran the show, and people told me that.
People
they told me
that,
he was the one that they looked at, not me, so that was perfect.
So, but to turn it back on you, congratulations. Employee of the Year, there's only one out of 9,000 or more employees. That's very special. And we learned that you received dozens of different individuals who wrote up, why you should deserve it, and it was wonderful. So congratulations.
Thank you. Thank you. It was an honor.
For those who may not know you as well as I do, you're a nurse clinician here, and you work on D7. So let's start there. What is a nurse clinician?
So my main job is I help to educate the families. I help to educate the staff. I work very closely with the residents to make sure that they are doing the best for our patients.
Right.
I do a lot of quality work and safety work.
Right. And you've been here for how many years?
I've been here.
You started like 1988.
I started
generally,
here.
1988. Yeah. We were saying before, that's the year I actually started medical school here. So we've been here about the same amount of time. Now, D7 is a floor that specializes in pediatric oncology, children with cancer often. How many years have you worked on that unit?
Most recently, I've been there since 2012. I worked in the Peds Melody's Clinic prior to that for a lot of years.
Right. So that's a real special place for you, taking care of that population, for sure. I've been on that unit many times when I do my senior leader rounding or just walking around. I've seen you there. I've seen how you interact with the patients and the family. It takes a special type of nurse, a special type of doctor to work with that population, right? Because obviously these are often very challenging situations. What attracts you to it? Why do you like to work in that area?
I think the pediatric oncology population, for me, I'm able to help people through the hard times, be there for them when they need it, teach the new nurses how to take care of these kids. The families are the most vulnerable.
Right.
And I think the HEMONC doctors, we learn so much from them. I love working with them. I don't know, it's always held a special place in my heart. Make a difference.
Yeah, for sure. And when you do that work, obviously you create lifelong relationships with the patients and the families, and you see many of them years later, right? When the children have fully healed, fully recovered, they're in remission, they're going on living their best lives, and you see them, right? That must be very special for you.
It is, and I see them, especially at the holidays. I see a lot of them out and about at the different events.
Right.
And it's amazing to see them, and it's so rewarding to see them healthy, happy with their own families.
Their own families.
It's great.
Yeah. Melodies of Christmas, obviously, Dancing in the Woods. Those are events that obviously draw some attention to the work that you and the team do up on D7 and in the Melody Center, for sure. You mentioned some of the doctors you've worked with. Obviously, we have a couple icons that are retiring, right? Dr. Porter, Dr. Pierce, you worked with them for many years, correct?
Yes, I remember Dr. Porter as a chief resident here. So we're going way back.
Way back. Now, any other places in the hospital that you've worked in other than those 2 locations? Where else have you worked during your time here at Albany Med?
Nope, the only places I've worked were on
Melodies.
D7 and in the Melody Center.
So that really has been your primary focus for all those years. Now, you mentioned your family. You have 3 daughters. All of them are in some form of the medical field. They mentioned that, or we mentioned that at your Employee of the Year celebration. 2 of your daughters have worked in the pediatric ICU, and one is currently there now, correct?
That's right. Taylor is now working in the pediatric ICU. Loving it.
What's that?
Loving it.
Loving it. I'm sure she's doing great. Alexis, her sister, also worked in the pediatric ICU, and she is now a nurse practitioner, which is wonderful.
Yep,
that's
she's
wonderful.
Moved on.
Yeah, and you have one more who's a social worker as well.
Yeah, Morgan's a social worker at Amsterdam Schools.
Wonderful.
Loves
wonderful. And we know each other outside of work as well, correct? Obviously, I think maybe the first place I might have met you was up at Double H Ranch, a camp, obviously, that provides a camp experience for children between the ages of, say, 6 and 16. Gives them that camp experience if they have a medically qualifying condition. Obviously, you know, having a nurse like you up there is very important because many of those children either are currently being treated for cancer, recently had cancer, yet because of individuals like you, they can go up there and they can swim and ride a horse and zip line and do all the types of camp experiences. You've been volunteering up there for many, many years, correct?
Many years. And my daughters were up there doing counselors.
Right.
With your kids.
That's right, they were
Right.
indeed.
They spent a lot of time with your kids
Wearing
up
a
there.
yellow backpack.
That's right, a yellow backpack all the time.
And then that's where I met you. In fact, we did several sessions together, and your husband Joe, of course, up there.
Yes, loves it.
We call him Body Shop Joe because the Body Shop is where the children come if they need to be checked out medically. And people may not know it's called the Body Shop because the camp was co-founded by Paul Newman, who liked to work on cars, race cars, right? So Body Shop, and we call him Body Shop Joe. He's a jack of all trades, does whatever's needed up there.
Whatever you tell him to do,
That's
he does.
right. That's right.
Got to give him credit.
That's right. So talk a little bit about going back to your job here. What's your average day like here? What do you do kind of when you come in, or does each day kind of take you in a path that you don't know until you get there?
Each day is a little bit different. I normally start my day around 6 o'clock to meet up with my night folks to hear how their night went.
Right.
Help them through their trials and tribulations of nursing. There are a lot of new grads on nights.
Right.
And then we set people up for their procedures, and then we do a lot of rounds with the doctors at that point in time. A lot of teaching rounds goes on, the nurses and the doctors, we do that. And then a lot of family meetings happen.
Right.
I spend a lot of time in meetings trying to make improvements where necessary,
Right.
Developing education for the staff where necessary.
You act as, in many ways, that middle between the patients and the physicians often. I see you often probably seeing yourself maybe as an advocate for, ambassador for the patients to make sure that they get what they need. I'm sure for a lot of the parents that are dealing with this brand new, that's got to be obviously overwhelming, and you must play a very important role trying to help them navigate those first few days.
I think I pride myself in teaching the nurses that too. Be the advocate for your patients and teaching the patients to be advocates for themselves up there.
Right, for sure.
To help them get the best care that they need and deserve.
How much has oncology care, cancer care changed over your career here? I mean, are there new procedures? Are there new therapies? So said another way, are you constantly having to educate yourself so that you are in a position to help educate others?
So many new medications that are coming out that are improving the survival rate of all of these children come out.
Right.
Educating myself, the patients, the nurses on all the side effects and what to do with all of them.
Right.
Yeah, it's interesting though, a lot of the procedures that we've done for years are doing it. They're working.
Right. They are working. I mean, that's one of the things we talk about as we're not a hospital, right? We're an academic medical center.
Right.
And you interface with all aspects of that. So clinical care, obviously, education, you're right there. You're educating, you're helping educate our learners, our residents, our students, but you're also educating the parents and often the patient themselves. And then research. And I know there's a lot of research that takes place on that floor, clinical trials, right? And I'm sure that must feel good that you're helping kind of advance the field of oncology, because what we learn at Albany Med then can be used at other hospitals throughout the country.
Yeah, and these kids that, parents agree to consent to be on studies that eventually have led to the progress where we are now.
Right. Yeah, for sure. Talk about the bravery of some of those children that you deal with. Obviously, they must inspire you to see how strong they can be.
I think that's the biggest thing when you ask why people want to work in oncology. Kids are so resilient, and they're brave. They do whatever you ask them to do. They understand the importance of it. They know. They just get it.
Right. So let's talk a little bit about the Employee of the Year. Now you get your own parking spot.
I do.
Where are you going to go? Are you going to take my spot?
I'm going to take Dr. McKenna's spot. Wherever it is, it doesn't matter. I'm taking it.
But there's some nice things that come along with that. And I'm sure you heard from people that you worked with at Albany Med for many, many years. They must have reached out to you and congratulated you. That must have been fun.
It was an honor. it was a humbling experience, I have to say.
Right.
People that I haven't talked to in years have reached out and just told me how
Right.
well deserving I was.
You
and
are.
It really, it made me feel good.
It should. It should. You should know that every Monday at 8 o'clock, I do new employee orientation, and I meet the new employees, which is always wonderful. We talk about our mission, our vision, our values. We talk about the history of Albany Med, our strategic plan, our tactical plan, our goals. And the first slide is always me and the incumbent employee of the year. So last year was Jay Ayotte, right, our
Yeah.
library technician. So for the next 52 weeks, every Monday morning at 8 o'clock,
There
you'll
it
be
is,
right
my-
there, and I'll tell them about you and the work that you do here. But what I tell the workforce is this person, in this case you, represent the best of us, and that our mission is so important. We can't do it without our workforce, and I talk a little bit about what it means to me to have employees like you there. So we'll spend the next year together, whether you're there or not, at New Employee Orientation.
We'll be best friends.
When I meet with the new employees, sometimes they'll ask me questions at the end. I encourage them to do that. Let me channel you a little bit. If I was to ask you a question, which would be, what advice would you give to a new employee here? So you're the employee of the year. Obviously, you've had an incredible success here. But to someone who's sitting in the audience for the first time, day one, orientation, what advice would you give them if they want to have a productive, happy career here at Albany Med?
I would tell people that I think they need to be involved, be aware of what's happening throughout the hospital. There's many opportunities that you can join into. Just even outside of your work on the floor, a lot of volunteer opportunities. There's just a lot for you to allow yourself to be involved in. I think that as a new employee, I think you need to know that there are people out there that want to help you with everything.
Right.
And you want to be that person. You ultimately want to be the one that's going to help everybody.
Right.
You want to be the one that shows the respect to everybody, that is the best communicator,
Right.
that's the best advocate.
What about the idea of, you where you go at Albany Med may not be exactly where you think you're going to go? Meaning you may want to zig and you may zag because a job may open up that you weren't expecting, or an opportunity may come up that you weren't planning for. That's what's, in my opinion, what one of the wonderful things about Albany Med is that we are large, and many opportunities that we may not be expecting happen to us. I suspect that happened to you, and I think sometimes the recommendation is just be open for those possibilities as they come forward.
Yeah, there's so many possibilities. I didn't think I would ever be in the role that I was in now.
Right.
I received my master's degree when I was 29 years old, didn't use it for years,
Right.
thinking that, I was going to stay in the Hem-Onc clinic that I loved. That's where my heart was. And then this opportunity on the floor opened up for me. So yeah, be open to the possibilities. There's so much here for you.
So what's the future hold for you? Anything that you're looking forward to in the next few years here at Albany Med? Any goals, or just continuing to work on the things you're working on?
Yeah, I think I want to, I actually was talking to the trauma program. I think I want to volunteer some more with their programs.
Yes.
See what's happening there. They have a lot going on, so I'm
In
very
the trauma
interested
program.
in that. Yeah.
With like
a lot of
Colleen
their outreach
Savage.
and that, yeah, a lot going on there.
That's
So,
great.
Yeah.
That's great.
So I think I'd like to focus some of my energy there.
Good.
And get the staff up on our floor, focusing their energy there.
Excellent. Are there some patients who come up there who are some of the trauma patients? And obviously the primary focus would be on the oncology patients, but there's other patients there as well.
Oh yeah, we see, the epilepsy monitoring too,
Right.
that's a big one on our floor. We see all surgical patients,
Right.
we see trauma patients.
Right.
We get a lot of the patients that are trauma after the
Right.
ICU. But we see every different type of service up there.
And that's an important point. Obviously, we focused on the aspect related to oncology, but as a nurse clinician, you have to be up to speed on all different areas, not just the oncology, but the epilepsy and the trauma care and the surgical care.
Right.
And you work with all those different services, which is why you probably got so many nominations, because you work with so many of them.
I work with a lot of different
Yeah,
groups.
for
I really
sure.
do.
They
The
do.
pediatrics has a lot of different specialties
Yep.
that
Wow.
are up there. So
Very good, very good. Well, we congratulate you, seriously. It's a wonderful honor. Like I said, over 9,000 employees, and to be identified as the Employee of the Year is wonderful. So enjoy the next 365 days. park anywhere you want and take full advantage of it. But most importantly, we thank you, and we thank your family, right? Because we know that being an Albany Med, part of our Albany Med family is certainly an Umholtz family affair, and we appreciate all of them as well. So congratulations, and thank you very much.
I thank you very much for everything. Love Albany Med.